Welcome again to Kim's Bioproduction Academy. So we have discussed about cervical vertebrae. We said cervical vertebrae are 7 in number. The first one is atlas, the second is the axis. Then we're remaining with 5 other normal cervical vertebrae, and you can check we have 5, but I have one as the demonstration, and you can check it has a lot of protrusions. That is when you will know that these are the other 7 cervical vertebrae. So you can check from this point. This one is your centrum, and this is your centrum, and this one is our centrum at the anterior end. This is our centrum that you can check there is an extension. This at our posterior end, and you can check at our posterior end at this point it will be having a cartilage. It has a cartilage already. And what's the role of that cartilage? It's to reduce friction between the other vertebrae. So you see, the vertebrae are arranged, they are bones which are arranged in a line. So from one vertebrae to another vertebrae, there should be a cartilage. And we're saying the cartilage is to reduce friction. Then the role of the centrum. You understand about the role of the centrum. What have we said about the role of the centrum? It will be supporting the other vertebrae or the upper vertebrae. Then from that point we have the neurocanal. The same role of the neurocanal is the passage of the spinal cord. We have the role of the centrum is supporting and even protection of the spinal cord. Then we have something called articular facet. You can check this one is the neurospine. Within this intersection is what we are calling the neural arc, and the neural arc, its role is to protect. And you can check this arc section. This whole section is the neural arc, and the neural arc will be protecting this spinal cord. So these are bone from the outer section, then this one is the bone from the centrum. So this is the centrum section, this other point. Hope you understand what I'm saying. I'm saying from this outer section is attachment to the centrum. Then from this other section is the bone from the neural arc, and this will be serving the role of the protection of that spinal cord inside the neural canal. Then you can check we have a lot of protrusions. We are saying this one is short and broad with primed neurospine. So the neurospine for the other cervical vertebrae are highly primed. They are primed to what? They have a lot of priming. We can get the pre-psychobophysis and even the post-psychobophysis, and you can check from this other end. So this one is what we are calling the anterior articular facet. Then from this point, so we are speaking about what this one, the upper section is the what? Anterior articular facet, and you can check it's an articulation point. So we are calling anterior articular facet, and this anterior articular facet we are speaking about because this bone is the one that articulates at this point. So this one is our axis, sorry. So and our axis will be articulating at this manner, and this the articulation points. It's articulating at the anterior articular facet of the other cervical vertebrae. Then from that point I've said we have the pre and we have the post. So we have two at this point. I don't know if it's clear. We have these on the upper, on the far end, then at the back section. So the one protrusion at the fore section is the pre-psychobophysis. Then this at the rear is the post-psychobophysis. Then the ones that I'm holding here, you can check about the centrum and this one. This one is what we are calling the transverse process. All those protrusions or the bone protrusions or plunging of the bones is just to increase surface area for muscle attachment. Then from that point still you can check some perforations, and these perforations you can check this perforation, and this perforation is what we are calling what? I'm speaking about this perforation. I don't know if you can check it well. Yeah, I'm seeing it's not coming clear. This one, this is what we are calling the vertebrae canal, and that vertebrae canal is for the passage of the vertebrae arteries. So in what the vertebrae canal allows the vertebrae arteries to pass through, and the vertebrae arteries will do what? Will allow passage of the nerves, muscles, and even blood vessels. That's the same role. Then From this bone, I think we have discussed everything here. So, and that is the end of the other cervical vertebrae. Other cervical vertebrae. Thank you very much.